Good evening, Honorable and Mrs. Lee, and welcome to everyone here this evening. I'm Jennifer Zyla, and I'm team member of Project Cancer Crossing. I'm a breast cancer patient and have been one since December 2008. Now, I would like to speak to you about two things this evening. One is what it is like to be a cancer patient, and how Project Cancer Crossing is going to help cancer patients. Ever since Dr. Luke asked me to speak, I have been struggling with what to say. I feel this project is about facilitating financial relief to cancer patients for small expenses that are not covered by our healthcare system, seem insignificant and do add up and do cause stress. I would rather talk about that than talk about myself, but I think I have some thoughts that might help many of you. So if you'll indulge me just for a bit, I would like to tell you what being a cancer patient is like for me and some of what I have learned. Now, upon diagnosis, it doesn't matter what type of cancer you have. It doesn't matter what stage of cancer you have. The thing is, you think you will die of cancer, and you think it will be soon. The fact is, more often than not, you live much longer than you think you will, and as a result, you wrap up this life many times over. In December 2008, I was diagnosed with breast cancer, and 1 month later, it was discovered that the cancer had spread. There are the mechanics of being a cancer patient that are many and varied. Diagnostic scans, blood work, PICC lines, IVs, chemotherapy, anti-nauseants, steroids, other prescription drugs, radiation therapy, surgery, drains, portacatheters, side effects of drugs, no hair, physical weakness, chemo brain, to name a few, doctor visits, group therapy, rinse and repeat. You might wonder how a person manages to undergo all this. Not only the mechanics of being a cancer patient, but in addition, enduring the stigma of having cancer, which so many fear because the disease has no definitive cure. Sure, more and more people are surviving cancer. The scales are tipping overall in favor of survivor, but cancer is still a disease wrought with fear and loathing. And even though it's not contagious, many of your friends and people you thought you could lean on for support scatter. It's hard to explain, but when you yourself are facing these challenges, your mind does a back and forth. You say to yourself that you can do this next step, whether it be a diagnostic test, a treatment, a doctor visit for test results, whatever the next step is, your mind flushes through what's coming again and again. And from somewhere deep down, I don't know actually where, you are able to frame the next step into something manageable. You just do it. You have a survival instinct that kicks in that helps carry you through the harsh mechanics of being a cancer patient. As treatment progresses, you become physically more and more exhausted. Whether your prognosis is favorable or not, treatment taxes the body and exhaustion sets in. As your body fatigues, your mind has an aha moment. It is at that moment where you take ownership over the fact that your outcome is uncertain, because cancer is an unpredictable being, and it actually becomes okay. Again, I don't know why, but you come to a point of inner peace. This is a strange place because for me, I was consumed with nature and the faces of my loved ones. Imagine the smell of the rain, the grass, the blue of the sky, the sound of a wave, the sound of a train whistle in the distance, the feel of the wind on your face, the sun on your skin. The eyes of your loved ones, their smile, All these things become the things you want to hold on to, the things you want to remember. You want to connect with your friends and family, have a coffee or lunch here and there, even though it might be the only thing you can manage for the day. But you do it because you realize that personal connections are really the basis of life. Not your fancy car, not your fancy purse, not your fancy boat, or anything fancy you've wanted and never got. What is dearest in life are those you are connected to. It's the relationships we have with others that feed the soul. Not your awesome house with its built-in cappuccino maker. I remember when my niece took her lunch hour to come over and play the Seinfeld game with me, to steal the phrase, priceless. The mother of my son's friend, bringing over a get-well card and a cake, even though I didn't know her that well. She mentioned she was going to Paris. I told her that I could only dream of such a trip. She brought back for me a beautiful black and white photo of a Paris landmark. I have it hung at my makeup table to this day, a reminder of the kindness. Priceless. My husband Brian taking me out in the car for a ride in the country on the weekend. I could see the sunflowers in full bloom, see the leaves changing color, see the land frozen by the beautiful blanket of snow, see and feel the spring melt. Priceless. My concern is for anyone who has ever taken care of a cancer patient. I can only imagine the level of stress and anxiety such a responsibility entails. Please know that the more times you ask the patient how they feel, or if they are okay, they feel less and less well and less okay. Stop it. What can you do for a cancer patient that is priceless? Simply state, I am here for you whenever you need, 24/7. Just let me know and I will be by your side. Sorry. If we need something, we will let you know. If you keep asking us how we are feeling, we want to slug you. Most cancer patients will take time off work and take time away from any volunteer committees they may have been involved in, and you quickly feel irrelevant. People say, leave her alone, she's battling cancer. That's the last thing we want. We want to hear what is going on at work. We want to be updated on how the volunteer activities are progressing. Pick up the phone, give us a call, send us an email, keep us in the loop. Most importantly, caregivers, take care of yourself. I know every time the patient coughs or moans, you feel sheer panic and are on the edge wondering, is this it? Please don't panic. What will be, will be. You cannot control anyone's outcome, but your kindness and caring and calmness will go a long way to making the patient feel content about where their life is at. In late 2009, I expected to die. Based on the nature of my cancer and the state of my body after 15 grueling rounds of aggressive chemo, I felt done for. I was barely able to walk. I was heavy with water weight from chemo and steroids, bald and exhausted. I love Las Vegas and felt compelled to go back and say goodbye, despite my ravaged body. I went on a 4-day trip with my sister-in-law and 2 nieces. They pushed me down the strip in a wheelchair as I could barely walk. I remember the physical pain and agony of the return trip home, but most of all, I remember leaving Las Vegas in the middle of the night, the plane making its turn north, and I could see the strip all shiny and bright. Goodbye, Las Vegas, I mouthed. I was at peace. I returned home to find my odds of survival were 50%. That kind of perked me up, because in January 2009, I had received the Quality of Life speech. My oncologist was away, so I had a fill-in who told me that because my cancer had spread, there was no way to fix me. So the object of my treatment would be a regimen of chemo that would hopefully keep the cancer from spreading further and keep me alive longer. In 2009 and 2010, I was living as though I were going to die. My mind was consumed with planning my funeral, my final resting place, my will, making peace with everyone and everybody. Then suddenly one day, I issued myself a challenge. I challenged myself that within a month or two, that I be able to climb a flight of stairs with only one hand holding the rail and not two pulling me up. I achieved that goal. I then issued myself another goal, and that was to be able to climb a flight of stairs without holding onto the rail. A few months later, mission accomplished. Then I challenged myself to be able to lightly jog up the stairs. I got to that. Then I rejoined a community committee that involved a large construction project. I took on the role of chair. Immediately, a fellow committee member asked me, given the state of your health, do you think you can follow through with this project? I was immediately incensed. My response to him was, can you guarantee me that in 6 months you will be alive and well? And I want to guarantee. His response was, of course not. I told him that our conversation was over. He soon after left the committee. I had nothing to do with it. Point being, I had changed the way I was living. Instead of living as though I were preparing to die, I was living as though I had a future. To this day, I continue to live as though I have a future. It's my choice, and it's right for me. Doctors don't know everything. Sorry. No two cancers are identical, and no two people are identical. I stand before you with no detectable cancer. Okay, fair enough. Fair enough, I have never left treatment. I have been receiving treatment every 3 weeks for the past 5.25 years. I am currently not on chemo, but instead an immunotherapy which does not cause hair loss, so you wouldn't know to look at me that I'm a cancer patient. But the physical side effects of the aggressive chemos linger. You know, stairs are difficult to climb, running or jogging is barely possible. But I'm here, you know, really, I don't know for how much longer. You know,
Nobody knows.
Nobody knows, exactly. And I'm okay with that. I will say, though, while I'm here, I do have the goal of going back to Las Vegas. And this time, walking briskly or lightly jogging down the strip at night. I want to see the city I had said goodbye to. I want to go back and say, well, hello there. And Las Vegas in my mind, you know how we all have these, you know, we play things in our mind. Las Vegas would reply, here's looking at you, kid. As part of living as though I have a future, I have joined the Cancer Crossing team. I have been a member since the summer of 2012. This has been a most rewarding project because each and every cancer patient, caregiver, or medical professional has a unique story and they want to tell it. It's almost like it's therapeutic. When you are diagnosed with cancer, you are barraged with clinical brochures and websites you can turn to for information, all of which is scary. Wouldn't it be nice to have Cancer Crossing to turn to? Messages from people who have been on your journey. The talk isn't about the specifics of the cancer. The talk is about how to get the most out of life while you're here. So many people coast through life on autopilot, too busy, for much beyond work, the annual vacation, and shuttling kids to activities, maybe taking care of aging parents. The years fly by and you blink and find you are headlong into your twilight years, and you ask yourself, What have I done with my life? Cancer Crossing will be a tool for everybody, not just cancer patients or caregivers, but a learning tool on how to live a life so if you are suddenly faced with a serious illness, you don't look back and have a pile of regrets or shoulda, woulda, couldas, but instead look back and feel like you lived in the moment and lived richly and deeply and in a meaningful way. Sorry. Net proceeds from our book sales will go towards creating a patient fund to assist cancer patients with expenses that are not covered by our healthcare system or private insurance. Universal healthcare is really not universal. Private insurance covers some gaps, but there remain many gaps unfilled. There's so many out-of-pocket expenses cancer patients must pay, yet most likely they have taken time away from their job, utilizing any vacation or sick time they have, which quickly depletes. So they end up on social assistance of some sort, or if self-employed, those patients have to downsize the business during the illness. And most business owners have no vacation or sick time which accrues, so they simply lose income and are not eligible for EI. Any way you slice it, income goes down, but expenses certainly do not. Parking at health centers is ridiculously expensive, and dare I say a racket. I hope no one here owns a I have no coverage for prescription drugs, but I paid for all the anti-nauseants, one of which is outrageously expensive, because I wanted to be as well as possible during treatment. I can't tell you how many people I sat beside during chemo who did not buy pricey anti-nauseants because they couldn't afford it, and most paid mightily with severe nausea. Imagine a young family where a parent needs chemo and needs funds to cover the cost of a babysitter. The Guardian Angel Room offers free waves, but I wanted something a little better, a little more natural looking, so I paid out of pocket. The psychological effects of hair loss are huge. To get the most natural looking wig possible is the mission of so many women. They're not covered by health care and can run in the hundreds of dollars. It's these types of expenses we aim to build a fund for and to administer directly to the patient. Grassroots to grassroots forever. If we can help even 5 or 10 families with some parking or prescription drugs or child care, then we've made a difference. Our objective, though, is to go well beyond that. As much as we champion and hope for a cure, we are not in the business of finding a cure. We aim to help those make the cancer journey bearable, as they are indeed very rough days. I hope you will support the Cancer Crossing Project. If you go to our blog, cancercrossing.ca, you can donate via PayPal. And today we were PayPal verified and received our first donation. Yay! So the button works. We cannot offer tax receipts, as the process to become a registered charity is seemingly endless, but we can offer you recognition in our book. We anticipate that Cancer Crossing will be a series of booklets, but we're still working on these details. The goal of offering cancer patients financial relief is our main objective, and we look forward to our first patient contribution in 2015. So you can help us by donating to the production of our ebook, or you can help us by donating specifically to the fund. Either way, you can play a direct role in improving the status of cancer patients right here in Manitoba very, very soon. Thank you for your time, and thank you for coming